Hey everyone, looks like you guys have been digging into some pretty heavy stuff, influenza and a new painkiller. We've got a ton of stuff to go through, articles, research, some news from Singapore's Ministry of Health, even a YouTube medical deep dive.
Sounds like we've got our work cut out for us.
You can say that again, so ready to get started.
Absolutely, let's dive right in.
All right, well, let's kick things off with influenza. It's been making headlines lately, and not for good reasons. We lost Taiwanese actress Barbie Hu recently due to complications from the flu.
Yeah, it's a sad story. It reminds us that the flu can be a lot more serious than just a little seasonal bug.
Right, it's definitely not something to take lightly, especially for certain groups.
Exactly. We need to remember that the elderly, young children, pregnant women, anyone with a weaker immune system, they're especially vulnerable.
And this Malaysian news article, Behind the Sneezing Cough, it really brings down all the details about influenza, how it spreads, the different types, all the symptoms. I gotta admit, reading about those symptoms, like the chills, muscle aches, and that crazy fatigue, it really makes you want to do everything you can to avoid getting sick.
It's not just about avoiding a few days of feeling lousy either. Influenza can lead to some pretty serious complications, like pneumonia.
Pneumonia.
Yeah, a lung infection. And that's sadly what happened with Barbie Hochu.
Wow. So even someone who seems healthy can develop those kinds of complications.
That's right, and it doesn't stop there. It can progress to respiratory failure, meaning your lungs can't supply your body with enough oxygen. And there's also sepsis. Sepsis is kind of like your body's emergency alarm going off in response to an infection. And that can cause widespread inflammation and even organ damage.
So you can really see why it's so important to get your flu shot, right?
Absolutely.
It's not just about avoiding feeling crummy for a few days. It could actually, you know, save your life.
Couldn't have said it better myself. And beyond the vaccine, good hygiene practices are really essential, like frequent hand washing, covering coughs and sneezes, and staying home when you're feeling under the weather.
Simple things, but they make a big difference.
They really do.
The article also mentioned the current influenza situation in Malaysia. No avian flu cases yet, which is good news.
Definitely.
But there are still a lot of people getting sick with influenza-like illnesses and severe acute respiratory infections. The numbers are actually kind of concerning.
It's a good reminder that we need to stay vigilant, even if we're not dealing with a massive outbreak. Influenza's still out there, and it's not going away anytime soon.
Okay, well, enough doom and gloom about getting sick. Let's talk about something a bit more hopeful. This new painkiller, Jornavex, it's been getting a lot of attention. The FDA just approved it, and some people are calling it a real game changer, especially when it comes to the opioid crisis.
That's right. It's looking pretty promising.
Yeah, and we really need safer alternatives for pain management. So this could be huge. This NBC News article you sent, it explains how Jornavex works. I'll admit, I got a little lost in all the technical jargon, but I think the main takeaway is that it blocks pain signals without messing with the brain's reward system, which is what makes opioids so addictive.
That's a great way to put it. It really targets a specific sodium channel called NaV 1.8, and that's what makes it different from those opioids, which act on a much wider range of brain receptors. So, this targeted approach, it's really what sets it apart.
Okay, that makes sense. The article mentioned that the clinical trials for Jornavex focused on patients recovering from tummy tucks and bunion surgeries,
Uh-huh.
and apparently it was just as effective as opioids for managing pain, but with fewer side effects. It's pretty impressive.
Yeah. And it's also important to keep in mind that those trials allowed for ibuprofen to be used as a rescue medication, meaning patients could take ibuprofen if the Jornavex wasn't doing enough to manage their pain.
Right.
So theoretically, Jornavex could be even more effective if you combine it with other painkillers.
That's a great point. So this really could revolutionize the way we handle pain after surgery. But the article also brought up some concerns, like the fact that we only have limited data on the long-term safety of Jornavs. Since it's a brand new drug, we don't really know what'll happen if people take it for a long time.
Right. More research is definitely needed to figure out what the long-term effect might be. And another issue is the potential for off-label use. It's approved for acute pain, which is like the pain you'd get after surgery, but some doctors might be tempted to prescribe it for chronic pain, which is pain that lasts for months or even years.
And that's where things could get tricky.
Exactly. It's really important to remember that Jornex probably isn't going to be effective for treating chronic pain. Actually, there was a trial for sciatica, which is a type of chronic pain, and that trial showed that Jornavex didn't work any better than a placebo.
So it's not some kind of miracle cure.
Right, and we need to be cautious about using it for chronic pain conditions.
But even if it doesn't completely replace opioids, at least it could be a step in the right direction.
Absolutely. If it can reduce our overall reliance on opioids, that's a win in my book.
Speaking of side effects, one of the articles you shared got me thinking about how medications can have all sorts of unexpected consequences.
Oh.
Yeah, like this article on hair loss. It talks about how inflammation, hormones, stress, even the food we eat can all play a role in hair loss.
That's an important point. We tend to think of hair loss as just a cosmetic issue, but it can often be a sign of something else going on in the body.
The article actually said that eating a high-fat diet can deplete the stem cells in your hair follicles. And those are crucial for hair growth, so I guess if I want to keep my hair, I got to lay off the burgers and fries, huh?
Well, it's all about balance, really, but what's fascinating is the way it works at a cellular level. A high-fat diet messes with what's called sonic hedgehog signaling.
Sonic hedgehog signaling.
Yeah, it's a signaling pathway that's really important for developing hair follicles and making hair growth. When it's disrupted, it can lead to inflammation and hair loss.
Wow, so the food we eat really has a direct impact on our hair follicles. Never thought about it like that before.
It really does, and it's not just diet either. The article also mentions how stress, particularly the hormone cortisol, can contribute to hair loss as well.
So less stress, fewer cheeseburgers, anything else I should be worried about?
Well, the article also points out that nutritional deficiencies can affect hair growth too, especially deficiencies in iron, zinc, and vitamin D. Those can all play a role.
Okay, wow, lots to consider. And here's where it gets interesting. The article also mentions that if you take NSAIDs, like ibuprofen, for a long time, that can also lead to hair loss because of the inflammatory effects. And remember how we were just talking about ibuprofen being used as a rescue medication in the Journavx trials?
Ah, I see what you mean.
Yeah, it just highlights how complicated things are. Journavx itself hasn't been linked to hair loss, but one of the alternatives that people might take instead, NSAIDs, they could actually contribute to the problem.
It's a great example of how everything's interconnected. And it's not always a straightforward answer. We need to look at the whole picture when it comes to medications and their effects.
For sure. So it's not just a simple matter of take this pill and everything will be fine. We really need to think about all the potential consequences, both good and bad.
Exactly.
It feels like every time we answer one question, we just end up with more questions. But I guess that's what keeps things interesting, right?
I think so. And it really highlights the fact that you've got to stay on top of things and really, advocate for yourself when it comes to your health.
Speaking of taking charge of your health, one of the articles from the Straits Times in Singapore talks about them creating a new communicable diseases agency. Sounds like they're really stepping up their public health game.
It does sound like they're serious about it, yeah. This new agency, it's basically bringing together all their public health functions that deal with infectious diseases, like detecting them, preventing them, controlling them, all of that. So basically, it streamlines everything and makes sure they're well prepared for future outbreaks, whatever might come their way.
The article mentioned they're focusing on things like educating the public, vaccination policies, surveillance, research, even international collaboration. Seems like a pretty comprehensive strategy.
Yeah, and they've appointed a really experienced leader, a guy named Professor Vernon Lee. He actually played a big role in Singapore's response to COVID-19.
So it seems like they're really taking a proactive approach to public health.
For sure.
Which brings us back to, what we as individuals can do to minimize our chances of getting influenza or, having it turn into something worse.
Well, the most important thing is to get vaccinated.
Yeah, the Malaysian article really emphasized that. Getting your annual flu shot is one of the most effective ways to protect yourself.
Exactly. And don't forget those basic hygiene practices we talked about.
Right, like washing your hands all the time, covering your mouth when you cough or sneeze, staying home if you're sick.
Those simple things can make a huge difference in slowing the spread of these respiratory illnesses.
Okay, so influenza check. What about Journavx? Are there any specific precautions people should take if their doctor prescribes this new painkiller?
Well, I think the most important thing is to follow your doctor's instructions very carefully and make sure you tell them right away if you notice any unusual side effects. Remember, Journavx is designed for short-term pain relief, so you shouldn't be taking it for longer than your doctor tells you to, and definitely don't use it for chronic pain without talking to them first.
So communication with your doctor is key.
Always.
All right, we've talked about preventing influenza and managing pain. But what about hair loss? Are there any steps we can take to avoid it, or at least minimize it, aside from, diet and stress management?
Well, the article on holistic hair care mentioned a few things. Scalp massage, for one. Apparently that can help stimulate blood flow to the hair follicles. And there are some physical therapies like low-level laser therapy and microneedling that have shown some promise in encouraging hair growth.
So it's not just about what you eat and how stressed you are. You actually have to take care of your scalp, too.
It's all about a holistic approach.
Interesting. It's amazing how all these different topics, influenza, painkillers, hair loss, they all seem totally unrelated. But in the end, they're all kind of connected.
Well, that just goes to show you how interconnected everything in the human body really is. It's such a complex system, and we're still learning about how all the pieces fit together.
Speaking of complex systems, I wanted to go back to that YouTube video we talked about earlier, the one called Medical Deep Dive. GLP-1 RAs and thyroid cancer risk.
Oh, right.
They mentioned a potential connection between those weight loss drugs and thyroid cancer, which is kind of concerning considering how popular these drugs are becoming.
Yeah, I can understand why people are worried, but it's important to keep things in perspective. The overall risk of developing thyroid cancer while you're taking one of those GLP-1 receptor agonists is still pretty low.
But it's something to be aware of, right? And to discuss with your doctor, especially if you have a family history of thyroid problems or anything like that.
Absolutely. And if you are taking one of those drugs, it's important to get regular thyroid checks, just to be safe. That way you can catch any problems early on.
Makes sense. The video also mentioned something called surveillance bias, which basically means that because we're more aware of this potential side effect now, doctors are ordering more tests and screenings, which might actually be leading to more diagnoses of thyroid cancer, even if those cancers would have gone unnoticed otherwise.
Right. It's a good reminder that just because two things happen at the same time, it doesn't necessarily mean that one caused the other.
Right. Correlation doesn't equal causation.
Exactly. We need more long-term studies to really understand the relationship between these drugs and thyroid cancer.
So lots of unanswered questions. On one hand, we have this new painkiller that could help us fight the opioid epidemic, but we need to be careful about the long-term risks. And then we have these weight loss drugs that are showing a lot of promise, but there are concerns about potential links to thyroid cancer. It's a tough situation.
It is, but I think the main takeaway is that the decision of whether or not to take a particular medication is a personal one. It's something you need to talk about with your doctor and make a decision together.
Because they're the experts, right?
They are, yes, but you're also an expert on your own body. You know yourself best.
Right. It's about finding that balance between trusting your doctor's knowledge and advocating for your own needs.
Exactly. And remember, it's always okay to ask questions. Don't be afraid to challenge your doctor or to get a second opinion or to do your own research.
It's your health. After all, you're the one in control.
Right. And the more informed you are, the better decisions you'll be able to make about your own health.
Okay, let's switch gears for a minute. One of the articles you sent me talks about diagnosing and treating pruritus in older adults. And I got to be honest, I had to look up what pruritus even meant.
Oh, yeah, that's just the medical term for itching.
Oh, itching. Okay, makes sense. But apparently it's a really common problem for older people.
It is. Our skin tends to get drier as we age, and that can lead to itching. But sometimes there are other underlying causes, too, like certain medications or skin conditions or even systemic diseases.
The article actually had a whole list of possible causes. Everything from something called bullous pemphigoid, which sounds kind of scary.
Oh, yeah, that's a skin condition that causes blisters.
Blisters, right. But it also listed things like scabies, lice, even HIV. So itching isn't always just about dry skin. It could be a sign of something much more serious.
That's exactly why it's so important to rule out those more serious causes before just assuming it's due to age-related dryness.
The article also emphasized the importance of annual checkups, especially if the doctor can't find an obvious cause right away, because sometimes those underlying conditions, like certain cancers, might not develop until later on.
That's why it's important to keep an eye on things and get checked out regularly.
The article also talked about drug-induced pruritus, itching that's caused by medications, basically, which seems especially relevant to older adults because they often take a lot of different medications.
Yeah, it can be really tough to figure out which drug is causing the problem, so it often takes some trial and error to get it right.
So it's not just about taking your pills, it's about paying attention to how your body reacts to those medications and letting your doctor know if something seems off.
Exactly.
The article suggested some non-drug ways to treat itching, like keeping your nails short so you don't scratch, avoiding hot showers, using mild soap, and moisturizing regularly.
Those simple things can make a big difference, yeah.
And it even mentioned some alternative therapies like acupuncture, cryotherapy, even music therapy. Sounds kind of out there.
Well, it's about finding what works for you, right?
True. So even something as minor as itching can actually be a sign of a bigger problem. And there are things we can do to address it, both with medication and through lifestyle changes.
Right, and it really reinforces the idea that our health is like a puzzle with all the pieces fitting together.
There's that theme again. Everything is connected. Seems like that's the main takeaway from this whole deep dive.
Well, it's a theme that runs through all aspects of our lives, not just our physical health.
Now you're getting philosophical on me.
Maybe a little, but it's true. Our mental, emotional, and social well-being, it's all tied to our physical health.
Okay, yeah, I see the big picture.
That's what we're going for.
Well, we've definitely covered a lot today. Viruses, painkillers, hair loss, itching, public health agencies, genetics, even personalized medicine. What else is there?
Oh, plenty. But I think we'll have to save that for another time.
Yeah, probably a good idea. My brain's officially full.
Mine too, but in a good way.
Definitely in a good way. It's always good to, get your brain working and think about things in new ways.
I couldn't agree more.
Well, I've definitely learned a lot from you today. Thanks for taking us on this deep dive.
It's been my pleasure.
So to bring it back to you, our listener, What does all of this mean for you? We've seen how scientific discoveries are constantly changing, that medications have both benefits and risks, and that the choices we make in our lives can have a big impact on our health. Plus, our bodies are incredibly complex, with everything connected.
It's about being informed, being proactive, and taking an active role in your own health.
Don't be afraid to ask your doctor questions, to get a second opinion, to do your own research. You're responsible for your own health.
And don't forget, you have a whole team of health professionals who are there to support you. You're not alone in this.
We've shared a ton of information today, but our goal is to help you make informed choices about your own health.
Stay curious, stay informed, and keep exploring.
And be sure to join us next time for another deep dive into a whole new world of knowledge. Until then, happy exploring. While we're on the topic of aging, all this talk about health and aging has got me thinking about something else you shared, that article about osteoporosis screening.
Yeah, that's a really important one, especially as we get older. Osteoporosis, which is sometimes called brittle bone disease, makes your bones weaker and more likely to break, especially hip fractures.
And hip fractures can be really dangerous for older people, right?
They can be, yeah. A hip fracture can mean losing your mobility, having to deal with chronic pain, and it can even shorten your lifespan.
So it's really important to hitch it early and get treatment. Tell me more about these new developments in osteoporosis screening. What's changed?
Well, the U.S. Preventive Services Task Force, they recently updated their recommendations on who should get screened. Now they say that all women 65 and older should be screened for osteoporosis.
So if you're a woman over 65 and you're listening to this, make sure you talk to your doctor about getting a bone density test.
Exactly. And they also recommend screening for younger women who are postmenopausal if they have certain risk factors. Things like a family history of osteoporosis, smoking, or if they've been taking steroids for a long time.
Okay, that makes sense. What about men? Do they need to be screened too?
Well, there's not enough evidence to make specific recommendations for men just yet. But if you're a man and you're concerned about osteoporosis, you should definitely talk to your doctor about it. It's better to be safe than sorry.
The article you sent talked about the pros and cons of screening. It sounds like the main benefit is catching it early.
Right. The earlier you catch it, the sooner you can start treatment and hopefully prevent those fractures from happening in the first place.
And what about the risks of getting screened? Are there any?
The risks are pretty minimal. The most common test is called a DXA scan, which stands for dual energy X-ray absorptiometry. And it's a pretty safe and painless procedure.
It uses a very low dose of radiation to measure how dense your bones are, which helps determine your risk of fractures.
That's right.
So it sounds like if you fall into one of those recommended groups, it's definitely a good idea to get screened.
Yeah, it's a simple test that could potentially save you a lot of trouble down the line.
Well, you've convinced me. I'm going to schedule a bone density test for myself first thing tomorrow. Better safe than sorry.
That's the spirit. It's always best to be proactive about your health.
I couldn't agree more. Well, it looks like we've reached the end of our deep dive, from influenza and new painkillers to hair loss, itching, and even osteoporosis. We've covered a lot of ground today.
We have, and we've only scratched the surface of all these complex topics, but hopefully we've given you some good information to start with, and now you can go do your own research and keep learning.
Remember, knowledge is power. The more you know about your body and how it works, the better choices you can make about your health.
Your health is a journey, not a destination. It's about making small changes over time that will make a big difference in the long run.
So keep learning, keep asking questions, and most importantly, take care of yourselves.
And until next time, stay curious, stay informed, and happy exploring. ER47